In 2019, the Philippines made one of its boldest steps in health reform with the passage of Republic Act 11223, or the Universal Health Care Act. This law recognizes health as a fundamental right, ensuring that no Filipino is left behind when it comes to accessing medical services. One of the most important features of this law is automatic enrollment into the National Health Insurance Program. Unlike before, where Filipinos had to apply for PhilHealth, the UHC Act guarantees coverage for everyone regardless of income, employment, or location. This eliminates barriers, especially for vulnerable groups. It also ensures services that are not only comprehensive from prevention to rehabilitation, but also equitable and of high quality, so every Filipino receives the same level of care. At the heart of UHC is primary care, with services starting in barangay health stations and rural health units. This allows for early detection and reduces unnecessary hospitalizations. To support this, local governments create service delivery networks or SDNs. These link community health facilities to higher-level hospitals, making healthcare seamless and continuous. PhilHealth coverage is also expanded, protecting families from catastrophic expenses. This ensures financial hardship is no longer a barrier to getting treatment. The law pursues three major goals. First, financial protection so families no longer risk bankruptcy from medical bills. Second, eliminating disparities, making sure that health services reach both urban centers and far-flung barangays. And third, strengthening health promotion and prevention, because preventing illness is always more effective than curing it. This law directly impacts community health nurses. You are the frontliners of primary care, the first point of contact for families in the community. Beyond providing basic health services, you educate families, facilitate referrals, and coordinate care across health networks. You play a vital role in implementing programs such as immunization, maternal and child health, and lifestyle disease prevention. Picture a barangay health station now integrated into a wider service delivery network. Instead of being isolated, it connects families to rural health units and provincial hospitals. Community health nurses ensure families know their PhilHealth benefits, assist with enrollment, and conduct home visits that extend care beyond hospital walls. This reflects the UHC principle that healthcare is not a one-time service, but a continuous journey of care. RA 11223 is more than just a law. It is a commitment to equity, quality, and compassion. And as community health nurses, you stand at the very heart of making universal health care a reality for every Filipino. The Universal Health Care Act is not the end of reform, it is the beginning of a healthier future for every Filipino. Together, through commitment and collaboration, we can make health for all more than a goal, we can make it a lived experience.